The nursing members of Unison, which is a Labour supporting union, have accepted the latest offer from the government. But, of course, despite the advice from their own leaders, the RCN members have rejected it. Are you disappointed by that?
I want to see an end to this dispute like everyone else. We've still got two more unions who are out balloting their members on the deal, so we'll wait and see what they say. Without speaking for the RCN, that's their job. My sense from talking to members who've been voting in this ballot is the result that they've cast, I think, reflects the depth of anger with the government, some of the rhetoric we've seen from government ministers during the dispute. At one point saying that nurses were helping Vladimir Putin by going on strike. I think that sort of rhetoric hasn't helped. And my fear is that, and I hope this dispute is resolved imminently for this year, my fear is we're going to end straight back here for the coming year's pay round. So I think what the government need to do, more than anything else actually, is to give NHS staff some sense of light at the end of the tunnel. So we're not back here month after month, year after year, because reading the headlines about a year of industrial action, patients can't afford it, the NHS can't afford it. I actually don't think staff themselves can afford it in terms of the pay they lose. So we've got to have a resolution to this dispute.
That's the government. But for once, the opposition could have an influence here. Would you like to take this opportunity to appeal to RCN members to follow their Unison colleagues and think again?
Well, they've obviously had their vote. One thing I would say to RCN, they're talking about an escalation of the dispute through the manner of the strike action they've taken. I think one of the reasons why the RCN has enjoyed widespread public support is that in previous rounds of industrial action, they have gone out of their way, in fact, to say, look, we're going to protect emergency care, we're going to protect cancer care. And I'm deeply worried about the risk of escalation of the nature of their dispute to remove what known as the derogations, the measures they put in place to protect those areas of care. I'd appeal to them, if they are going on strike again, to continue to protect patient care, because with the junior doctors' strikes this week, we'll see what the actual impact of that was in the coming days. But I'm really worried about patient safety, actually, in the middle of all of this.
So for absolute clarity, you think it would be wrong for the RCN to escalate by removing the protection for emergency life-saving care that they extended in previous strikes?
Yeah, there just aren't circumstances in which I'm going to sit on your programme and say I think it's right to remove cover for emergency care, for cancer care. I think that would be the wrong thing to do. I think the government have got to now bend over backwards to resolve the disputes, not just in relation to nurses, by the way, but junior doctors, because they're making the same mistakes all over again. We saw months and months of no negotiation with nursing, which led to disruption, but also a tremendous amount of bad will and bad feeling towards the government in the nursing profession. They're making the same mistakes all over again with junior doctors now, where even after 4 days of strike action this week, which was far more disruptive than the nurses' strike, there are still no negotiations, and I cannot for the life of me understand why. Today we've got the Health Secretary writing in The Sun saying he's worried about patient safety. Well, it's no point writing to a newspaper like an agony aunt. You're the Health Secretary. Show some leadership.
Well, let's talk about that. The junior doctors' pay demands around about 35%. It'll cost 1.65 billion gross. Labour's always very keen to tell the government to get round the table. Let's suppose you're the Health Secretary and you're around this mythical table. Would you accept the 35% demand being on the table? Would you accept that that's something that you would negotiate at that level?
Well, I've been very upfront with the BMA in saying that a 35% demand is not something that I would be able to deliver if I were the Health Secretary today.
So what's the point of getting around the table?
Because
they're saying they're not coming to the table unless the 35% is on the table.
I'm not sure that they are saying that.
I heard them on the telly yesterday saying exactly that.
To be fair of the BMA, and we're not always uncritical of each other, I think what they've said is they've made their 35% pay claim. They've explained why they've reached that figure. But what they have said is they're not setting preconditions for talks. And I think one of the things that we've surely got to have learned from the nurses' strike is don't set preconditions for talks, just sit around the table and talk and negotiate. And let's see if you can try and meet somewhere between the government's position of no compromise and the BMA's position, which is 35%, but a willingness to compromise.
So actually this is a message to the junior doctors, which is to say, drop the insistence that the government must have the 35% quote on the table, and to the government, drop all preconditions. Basically, what you're saying is, everybody stop saying, I'll come to the table if.
Yes.
Let's get to the table.
Drop preconditions. Just sit down and negotiate, because it's not in patients' interests for this disruption to continue. It's also not in the interests of staff. You know, NHS staff on picket lines do not want to be there. They want to be at work, serving their patients. What they do want, I think, is fair pay and some light at the end of the tunnel, that the terrible conditions they're working in the NHS are going to improve in the foreseeable future. And I think it's that sense of hopelessness and desperation that's been reflected in the ballot results that we're seeing.
Now, the doctors have been pretty clear about what they want. You've also been clear that a Labour government would demand reform if it were dealing with the situation now. One of the doctors' leaders, BMA chair, Philip Banfield, was on this programme a few weeks ago. Here's what he said about you. He said, I met with Wes Streeting this week and we had to agree to disagree that he doesn't understand general practice. Labour has a lot of work to do between now and an election. We've offered to help them with that, and we'll do business with anyone who has the right policies. Now, do you feel any more clued up about general practice since you've met him? Has he given you a little seminar?
Let me tell you what I see in general practice, which is, despite 1 million more appointments being provided by GPs since pre-pandemic levels, we still have a situation where people are struggling to get access to a GP, still scrambling to get through at 8 a.m. in the morning to book an appointment, as if we're still living in the 20th century rather than the 21st. And people often, especially those with ongoing medical conditions, struggling to see not just a doctor, but the same doctor for that continuity of care. And we've got to change the situation for patients primarily, but also for people working in general practice who I think are increasingly burned out and demoralised. And what I see in the NHS at the moment as a system is the worst of all worlds, which is we do late diagnosis, which means both more expensive and less effective treatment.
I'm going to say so. You're telling me about diagnosis. I want to know what you want to do.
But what we want to do is shift the focus of healthcare out of the hospital into the community, more primary care. To do that, of course, you need to have the staff. That's why we've committed to the biggest expansion of NHS staff in history, doubling the number of medical school places as the NHS has asked for, as well as increasing nursing and midwifery clinical training places and a whole range of other staff roles. Because unless we've got the doctors we need, we're not going to get patients seen on time.
I know you're going to tell me that you'll pay for that with a non-dom tax. Just very quickly, the non-dom tax, by my reckoning, is now paying for your 7,500 doctors. It's also paying for breakfast clubs in schools. I think it's also paying for police officers. Now, of course, you can get into a room and fight with Yvette Cooper for a...
No, so two things, Trevor.
You can fight for...
It's paying...
How much is this... this is a kind of magical expanding
No, it's
tax,
not.
Isn't it?
No, it's not. I'm glad you asked this question. So, two things it's paying for. It's paying for the biggest expansion of NHS staff in history, £1.6 billion. It's paying for the expansion of primary school breakfast clubs to every primary school. And that's met within the more than £3 billion spending envelope that provides. And all of Labour's policies at the next election are going to be fully costed
and the windfall tax is paying for everything else, is it?
The windfall tax is obviously paying for measures to help with people's energy bills, which is the right thing to do. And there is a running theme here, Trevor, which is not only are our policies fully costed and fully funded, but there's fairness baked into how we pay for it. Because under the Conservatives, we've got the worst of all worlds, which is working people being clobbered with higher taxes that they can't really afford. And we've gone from low growth to zero growth in the economy under the Conservatives.
There is a question about whether there'll be any non-doms left, because the numbers are shrinking every time you say that.
We always hear this, right? That we hike up taxes on working people effortlessly, but the moment you say, let's ask people with broad shoulders to pay, the Conservatives start crying over their coffee to say, but they can't afford it. I mean, cry me a river.
I'm just making an observation that the numbers are shrinking 10% year by year, because every time you say we're going to tax you, they decide not to come here.
But
let's talk about Labour's own campaign. You put out this ad campaign attacking Rishi Sunak on a series of fronts. Was that a mistake?
No.
Here we are. Here we are. I mean, do you genuinely, Wes Streeting, do you genuinely believe that man there thinks that adults convicted of sexually assaulting children should not go to prison.
Well,
do you believe that? Don't tell me what you meant. Do you believe that?
Well, if he doesn't believe that,
no.
then why
do you
have we
believe
got...
that?
Well, ask Rishi Sunak, because he lets 4,500 adults convicted of sexually assaulting children under 16.
No, you're giving me
serve
a
no
logic.
prison time.
I'm asking you, you've met this guy. Do you think he actually thinks that people who have sexually assaulted children should not go to prison?
I'd like to believe that the answer is no, but look at the figure. The figures speak for themselves. Why is he allowing this to happen? And it's perfectly reasonable to challenge a Conservative Prime Minister on the abysmal failure of 13 years of Conservative government.
You keep sliding away from what your poster says, which is that this guy thinks that people who have assaulted children should not go to prison. Tell me the answer to this question. Do you think he thinks that, or do you not think he thinks that?
Well, I have to assume that he thinks that, because otherwise it's either that or incompetence, isn't it?
That's an astonishing thing to say about another human being.
Either he thinks it, which is bad, or he doesn't think it but isn't doing anything about it, which is equally bad. Either he's got the wrong policies and principles, or he's just incompetent and can't deliver. And either, I think, is a problem for the Prime Minister of the country. And Labour is absolutely right to take the gloves off and hold the government to account for 13 years of appalling failure on law and order, in the economy, in our public services. Nothing is working properly in this country after 13 years of Conservative government. And we're right to haul them over to the coals
you say Labour's taking
and
off,
to set out an alternative.
You say Labour's taking off the gloves. Let's look at what that well-known softie, former Labour Home Secretary David Blunkett said. He said, when I heard yesterday about a tweet from the Labour Party's official account suggesting that Rishi Sunak was somehow responsible for failing to lock up criminals who had abused children, I immediately thought my party is better than this. David Blunkett, well-known, kind of soft-hearted, would never get into the ring with the opposition. Come on.
Well,
Come on. This is an opportunity for you to say, look, this was a mistake.
I don't think it was a mistake at all. I absolutely stand by Labour's ads. And there's more to come. There's more to come.
We're going to get more of this, are we?
Yep. We're robustly holding the government to account for 13 years of failure. And Rishi Sunak doesn't get away with coming in at the last minute to replace yet another failing Conservative Prime Minister, to pretend that somehow he's a clean slate, that he's different from everything that's come before. Because we've had now enough chances, enough Prime Ministers under the Conservative Party. What we haven't got are results that deliver for the country, and we're right to hold them to account and right to set out a Labour alternative.
Wes Streeting, thank you very much.
Thanks for having me.